as a dentist, you're kind of not only looking at just the teeth, it's kind of this whole area. And sometimes we have patients, one of them came in and he had like pain here. And he was like, I don't know if it's from my tooth. And we took a cone beam CT, which is a 3D scan, and you're able to see the sinuses, and we saw that his sinuses were completely clogged. So as a dentist, you refer them to the ENT. At his next follow-up visit, for his next cleaning, he came in and we asked him, have you gone to the ENT? And so he said, oh, that thing's gone. And we were kind of like, did you see your doctor or anything? And he said, no, I've just been eating really healthy and I've been juicing and it's fine. It's not a problem anymore. It was very surprising, but we were a little skeptical, especially me more so than my mom, because I'm a little more traditional in the medical sense and I kind of like to see evidence. Another patient, she came in, horrible toothache. It was a root canal treated tooth that had been treated again. There was an infection there, and that tooth, we couldn't do anything to save it. So we had to pull it. In those cases, we definitely recommend a patient to have implants done. But then when we took her scans, her sinus was so infected, she had sinusitis. And with her bone level, she would need to have a sinus lift and bone graft so that she would have enough bone to place the implant. But with her sinuses the way they were, that wasn't an option for her, and she would really need to do something about her sinuses. A lot of the times they'll have to drain them, which involves surgery. It's a little more invasive. She was not happy to hear this. She didn't want surgery if she was already getting implant surgery and a sinus lift and a bone graft, which she couldn't even get at this point. And so we mentioned to her the case about the other guy. So she went to Kreation because there's one just down the street, and she bought a 5-day cleanse of just the green juices. And we followed up with her after because we were a little curious, and her sinuses were clear. She was able to get the sinus lift and the bone graft and eventually the implant without having to go through a surgery to drain her sinuses, which was awesome. It's good for her, and we would rather have them trying to do all these alternative things before rushing into something that's a lot more invasive and harder for your body to recover from. As a dental practitioner, I kind of emphasize whole body health because I'm doing my best to help you, but you need to go home, take care of yourself, brush your teeth, eat healthy, because that kind of all goes